Hi, my name is Patsy Giarda and I'm a Pediatric Nurse Practitioner at Wholistic Pediatrics and Family Care. Thank you so much for taking a few minutes out of your day so I can share some of the exciting updates in the Dietary Guidelines with you regarding your children. The updated Dietary Guidelines include recommendations across the lifespan. We're going to be discussing some of the new updates for children and infants today. The Dietary Guidelines are a recommendation list that are provided by the Dietary Guideline Committee, comprised of registered dietitians and medical doctors, with the goal of promoting health and preventing chronic illness and disease, such as cardiovascular disease, obesity, type 2 diabetes, and certain types of cancers. We know that nutrition plays a huge role in preventing many of these chronic illnesses, and we know that healthy eating starts at birth. We are thrilled to see that the latest updates include the age range 0 to 2 years old. There has not been a new update for children of that age group since 1985. Excitedly, we are happy to announce the new update that for children 0 to 6 months old, from birth until 6 months old, the recommended main dietary source is human milk, breast milk. And it's recommended, if possible, to give that baby breast milk exclusively until 6 months old, and then to continue on until after the first year if mom and baby are both accepting of that. So if breast milk is not able to be obtained from the birth mother, from a donor breast milk bank, then iron fortified formula is an acceptable substitute. Around 6 months old, babies will begin to show signs of readiness to start introducing complementary foods to that breast milk, the human milk or formula. And the signs of readiness include sitting up, holding themselves upright in a chair, holding their heads up, interest in food, reaching for food off your plate, watching you eat intently, bringing things toward their mouth. Those are all signs that your baby is excited and ready to start introducing foods. And it's recommended to start introducing very densely nutritious food at 6 months. We always advocate for avocado or a vegetable in puree form, and then slowly introducing more fruit and proteins. The densely nutritious food is where baby's going to begin to develop that healthy relationship and healthy dietary pattern for eating lifelong. The other exciting recommendations that have already been out and about in the pediatric world and recommended by the American Academy of Pediatrics, but are also included in the new dietary guidelines, are Allergen Introduction. It is recommended to introduce allergens, especially peanut butter or peanut powder, to infants shortly after they begin complementary foods. We found that by delaying foods of high allergenic possibility that we were creating more allergies that way. It's now recommended to not delay potential allergens and to introduce them after 6 months old and before the first birthday to try and help prevent them. Those include peanut butter, so introducing peanut butter into a little smear of puree, thinning it out so it's not that tacky consistency and babies are better easily capable to swallow it, as well as introducing eggs, soy, other tree nuts, cashew butter, everything in creamy form, so that way baby reduces the risk of choking hazard. And if babies are tolerating that well, we recommend continuing to expose baby to those foods every other week or more frequently if baby enjoys them. Those nut butters are a great source of protein. So the last guideline update that I'm going to share with you today is very exciting and very different from previous guidelines, is to completely eliminate added sugars and added calorie-free, zero-calorie sweeteners such as Splenda and stevia for all children under the age of 2. So the age of 2 and up is acceptable, but trying to limit the amount that you're giving to your child as much as possible. So no cakes, no cookies, no sugar under age 2 is now what we're finding is best recommended for your child, and we want to encourage families to give their children a good variety of vegetables, fruits, proteins, whole grains, and finding that their children begin to grow to love and continue those dietary eating patterns lifelong. So thank you so much for taking time to allow me to share these guideline updates with you. We will attach the full dietary guidelines to this video so you can review them and gather more information if desired on best methods of feeding your children. So we all here at Wholistic Pediatrics and Family wish you and your family a happy and healthy, safe 2021.